Hey there, my name is Armando Bernal. I am a board certified behavior analyst at Cole Academy, and today I will be going over antecedent interventions. Let me go ahead and just share my screen for everyone, and that way we can begin. Okay, so antecedent interventions are any kind of interventions that happen before a targeted problem behavior can arise. And what that means is essentially what behaviors we are considering to be inappropriate, and then looking toward trying to decrease these behaviors by providing different interventions, which we'll go into in just a bit, to then increase appropriate behaviors. So for instance, rather than showing aggression or self-injurious behavior, SIB, we are now seeing functional communication skills where the patient is able to express his wants and needs with his words or his signs rather than showing this aggression or SIB that we're just talking about. And so these supports allow for these desired behaviors to occur more frequently as a way to reduce the probability that inappropriate behaviors will occur. And these can be a number of things. So it could be items, events, conditions that occur day to day for the child that are presented more frequently in order to increase these certain behaviors. And as I was saying, so it could also be people, it could be time of day, it could be the environment. Maybe the patient shows more inappropriate behaviors with therapist A rather than therapist B. Or and vice versa, right? And so then we have to look at what can we do in order to allow the child to understand I need to act more appropriately in order to get the kind of reinforcement or the kind of attention that I'm looking for. And this can affect the likelihood of behavior. So if we're showing a lot more verbal praise by saying to the child, hey, I really like how you're walking with me, or hey, I love that you're eating that. And they see that I'm going to get more verbal praise by following appropriate behaviors rather than inappropriate, then the idea is that we'll see more of that than the inappropriate behavior. And so it could be also something that's missing or not being done is causing these behaviors to occur. It could be something that's present. Maybe there's something that is causing inappropriate behaviors to happen more often. So if we look at the two examples on the right, we see, for instance, that John's father has told his son to clean up his blocks and get ready for dinner. And then John begins to scream and run away from his father. And John just leaves to the other room. John's father just leaves to the other room, doesn't do anything about it. Where we see that nothing was really done in order to prepare John to clean up his blocks. But in the second example on the bottom right, we see that now John's father has provided a 5-minute and a 1-minute warning to clean up the blocks. And now John has no problem cleaning up the blocks because he has had this warning, he's had time to prep himself, and he moves on. So I get that they could be very different, right? But because of this antecedent intervention, we now see that John is able to move appropriately, and we're seeing the appropriate behavior and having dinner at the time that we would like, rather than having to deal with the now screaming child that we see in the first example. So when we look at the antecedent interventions, we also have to consider the motivating factors for what really drives the child to complete the task that we're asking him to do. And so we can either see factors that are decreasing effectiveness of an item or increasing the effectiveness on the item. On the left side, we see, for instance, the first time, the decreasing effectiveness. So if we have had a big lunch and we are completely full, and now we're asking a child to complete a certain task, and we say, hey, first do your work and then goldfish, the child is going to have less of a reason to complete the task for us because they've already eaten, and now the goldfish doesn't mean anything to them. As opposed to the opposite side that can increase the effectiveness. The child has not had a big lunch, and now the child is hungry and is willing to do certain tasks for us because we are offering a goldfish, for instance, in this edible idea. So we look at how can different situations, different conditions, as we spoke about earlier, cause a child to want to complete tasks more likely for us, rather than if there's no motivation behind it, are they really going to do it? The way we can determine motivating factors is by providing preference assessments. And now in other videos that we provided, we have talked about preference assessments. So I would recommend going through our playlist, seeing if we can find more examples of preference assessments to go into further detail. But in this situation, we can just briefly discuss it where preference assessments are used in order to determine a patient's choice. What is a child willing to work for? And this can be very quick, very fast. You can go to your child and say, hey, John, do you want this toy or this toy? And then see which one they pick. And now you know, okay, they prefer toy 1. And so I'm going to say, first do your work, and then you can have toy 1 in order to have that motivation and play like we talked about. And in order to maintain motivation, because we don't want a child to get oversatiated on it, right? We don't want a child to say, I always get this toy. I don't want that toy. And we're going to rotate different kinds of reinforcers. So we have this one toy that they've always chosen, but what about two different toys? Now we see, do you want this toy or this toy? And then that way we have a wide array of options for the child to choose from. And then that way they never get tired of one certain toy. They have a number of toys to go through. As well as limited access to high preference items. So if there's a toy they absolutely love, we're going to hold off on giving them that toy until we have one kind of task that we want them to accomplish that is very high need. So maybe there's problems going toilet training, right? And so we're going to hold off on this toy and only give the child this toy whenever they can appropriately go and use the toilet successfully. Another example we can use is behavioral momentum. And this is just a series of tasks, easy to follow tasks, that we can use that can lead up to a more difficult task. And the example I always think about is we are taking a test in college and we see that there's this one question that's very difficult and we're like, oh, we don't know if we can do it. And so we do one easy question and then another easy question and another easy question. And then we try our hand at the more difficult question, because now we've raised our confidence to say, okay, well, maybe I can do this question. And then it just allows us to accomplish the more difficult tasks. And this is the same kind of idea that we use for children that we're working with. So maybe they are having troubles. For instance, if we look on the image, being able to tie your shoes, for instance, or being able to count to 3, right? Or things like that. So we're gonna do clap your hands, great job. What's your name? High five. Count to 3, way to go. In this situation, the image is clean up your activity. And so they did 3 different tasks first before they went into this more difficult task of cleaning up the activity. Another idea that we can use for antecedent interventions is functional communication training. Now, we talked about this with the aggression, where we don't want the child to show the aggression, but rather we would like him or her to use her words. And so we look at functional communication training as an appropriate way to accomplish this. First, we have to figure out why a child is showing the different behaviors that they are. Now, everyone does every behavior they ever do for one of 4 reasons. Either tangible, they want something, attention, sensory, it feels good to them, or escape, they're trying to get out of something. And once you determine the function of that child's behavior, then you can go into, okay, what is it that we need to do in order to provide that correct functional communication? So step 2 in this process, providing a communicative response that replaces this undesired behavior. So instead of having the child show aggression because they need a pencil, we teach the child to have them say, hey, I need a pencil, or I want pencil, in order to get them to understand this is how we get the pencil appropriately, rather than showing aggression to get it inappropriately. Step 3 is providing that patient when prompts when attempting to complete the requested communicative response. So maybe they can't say, I want pencil, but at least they can say pencil. And then we get into, okay, what about want pencil? What about I want pencil? So slowly working our way up to the complete sentence, rather than just hoping for the best and hoping that they're able to say the complete sentence that we're asking them to do. Prompts are always very useful in order to guide patients into accomplishing the tasks that we're wanting them to. And then in step 4, we have been fading these prompts. So now that we provided these prompts to get them to say, I want pencil, now we're going to fade ourselves out. So instead of us directly telling them, now we only provide them with a model, and then we only provide them with the first sound of the sentence. And then that way it gets them going enough, so then that way they complete the sentence on their own. So one other kind of antecedent intervention would be called non-contingent reinforcement. And it's something that we use essentially at its own reinforcement schedule. And so, for instance, example of this would be for every 2 minutes, I'm going to give attention to this child that I'm working with, right? And so this, for instance, if the child needs attention, the attention that I'm providing him now is to decrease the inappropriate behavior I'm seeing and now increasing the appropriate behavior. We're going to determine the schedule based on the need of the child. And then we're going to thin the schedule over time, which means that we're just going to increase the amount of time that it takes before the child gets a certain kind of reinforcement, rather than doing it every 30 seconds, every 15 seconds, whatever the child may need. And providing the verbal specific praise. So allowing the child to understand why they're getting the praise that they are. And it doesn't matter if the child is showing different behaviors or not. The idea behind non-contingent reinforcement is that we're satiating the child, as we talked about earlier, on the type of reinforcement they're looking for. They're looking for attention, and sometimes they look for it inappropriately. Well, this allows them to see that they get it no matter what. And now they say, okay, well, I've already gotten it so much, I don't really want this attention anymore. And so the idea is that it'll begin to have the behavior start decreasing. And one thing just to really remember that I always try to remind my parents is to always have reasonable requests and differentiate. So I'm giving all of these types of interventions for the child to use, but it's important to have clear expectations and not just set rules. Every child's going to be different and it's going to require a different intervention. So maybe behavior momentum doesn't work out for your child, or maybe non-contingent reinforcement doesn't work out. That's okay. It's important to determine what is going to be best for your child, because that is what's going to allow them to succeed the most. So adapting a request to the needs of the patient. Maybe the child isn't able to say, I want toy. Maybe it's very difficult. So starting from toy and then want toy and then I want toy. A very basic level is going to be important, because if we can start at the basics, then we can move up to more challenging expectations as it goes on. And then that's how we start decreasing that behavior. Providing choices is always going to be really important as well, because if we can establish that buy-in, if the child has this toy that they're working for and they've chosen it, they're going to be more willing to work for you rather than seeing different kinds of behaviors because they didn't get a toy that they were wanting to work for. So some visual supports we have as well is the rules. So classroom rules are really good for the child in order to see this is what is expected of me from day to day. So we have walk in the classroom, be kind to your classmates. So it doesn't need to be anything, very specific. It can be things that you see in a normal classroom. It just gives them an idea of what to expect. We have first then boards, and I've said it verbally a few times now in the presentation, where we say first blank, then blank. So for instance, first work, then toy. And this just allows them to see the necessary steps to get to the required reinforcer. First, you have to clean up the activity, and then you get the toy that you were looking for. So that kind of attitude and just speaking in that kind of language is going to allow them to understand more simply the needs and the requirements that are expected to complete certain things first. Visual timers are always good. So if we say, hey, John, we need to sit for 1 minute, the child may not know what a minute is, and they may not know how long that is. For them, it could be an hour, right? They don't really understand. But allowing them to see a clock count down allows them to understand, okay, once this timer rings, that means I'm going to get my toy. So they're more willing to sit and wait because they see that there's only a set amount of time rather than what could have been an infinite amount of time for them. So visual timers are very good. Visual schedules are also really good. It allows the child to understand their day-to-day activities. So on the right, you'll see start is brushing teeth, and then it's washing hands, and then breakfast, and then it's time to go. So in this situation, the child understood this is my everyday activity that I have to do first before I can start my day throughout the rest of the time. This is just my morning, for instance. And then the child is able to take this one picture here and move it to the right once they're finished. So it's a lot like our checkoff sheets. Whenever we're having a things to do list, or whenever we have a grocery list, we have a certain list of items that we have, and then we check it off once we get it. It just provides a sense of accomplishment for the child to understand that they're accomplishing the certain tasks that have been set out for them. Choice boards are very good, especially when we talk about those preference assessments. That allows the child to understand these are all the things that I could be working for, and then allows them to have that buy-in to decide. So we say, hey, these are all the toys that we can work for. Which one do you want to work for? And if they chose build tower, that's great. So now we first work and then we can build our tower. Or if they choose puzzles, so first work and then puzzle. So a choice board just gives them a wide array of things that we can provide them, and then things that they're willing to do. Token boards are really great as well. It allows the child to understand different options, different kind of reinforcers that are available to them and what they're working for. And so, for instance, this child with the Paw Patrol token system is allowed to complete 5 different activities. And once the child is able to complete the 5 activities, the bottom pictures are all the reinforcers they could have. So they could work for computer time. They could work for a certain snack, maybe their favorite snack, maybe a puzzle that they enjoy. All of these things are acceptable to place, but the child first needs to complete the tasks that are given. And to make it more fun, you can individualize it for the child. So for instance, this child just really loves Paw Patrol. So it just makes them want to have it more. This child really loves pizza. And this is actually really great for children that are older. So for teenagers, right? So Paw Patrol, you wouldn't expect a 15, 16-year-old to have it, but maybe they really like pizza. Maybe they really enjoy that kind of thing. So you can individualize it, as I said earlier, to the patient's needs. So this is just more appropriate for them. It allows them to understand what they're working for, while at the same time having these reinforcers below to remind them of what their options are. So like kind of like a mini choice board in that sense. We also have task analyses. So task analyses is sort of like a visual schedule where you can see the step-by-step, but this is for a certain task. So for instance, this situation was for brushing teeth. And so once we brushed our teeth, the child was able to see a breakdown of everything that was going on. So then that way they were able to determine, okay, I accomplished step 1. What about step 2? What about step 3? And then you can break it down and provide the child with different reinforcers throughout each step, depending on where they need the most. So it's really just going to be based on you and the needs of your child. And this is a different variation of washed hands. So you don't need the exact pictures too. You can also use animation pictures, what is more easier to come by, that you feel like your child is going to be more understanding of. And if you need more information about these kind of visual supports, all of this can be found on the Autism Speaks website. It just allows different links to it and just more understanding of what these are. But if you have any questions, please feel free to reach out. My name again was Armando Bernal. I work at Cole Academy. I'm happy to answer any questions. I always love speaking with parents or any other professionals. But otherwise, please check out our YouTube playlist. We have many other different kinds of informational PowerPoints, anything that can just help you guys out. With that being said, I hope all of this is very helpful, and I really hope you guys have a great day. Thank you.